Hello, my name is Graham Charlton, and I'm the president, founder, and CEO of Wellspaces. Wellspace is a healthcare delivery and services organization, and I'm asking for $200,000 in exchange for 5% equity in the business. Before I get into that, though, a little bit of background of Wellspaces and the current climate that Wellspaces operates in. So, according to the CDC, chronic disease that is avoidable with preventative care services accounts for 75% of the healthcare spending, or roughly $260 billion a year. Additionally, from the patient's perspective, there's about 80 million millennials in the United States, and millennials are twice as likely as older adults to not have a primary care provider. Many, in fact, search for care in other forms outside of the walls of a hospital or clinic. Additionally, in 2019, the U.S. spent over $3.7 trillion on overhead and administration, which is more than double any other country in the world. And likely as a result of policy and the refusal to increase physician reimbursement while imposing more regulation and compliance, has caused most private practices in the United States to close. So what is Wellspaces? Wellspace is a shared and private co-working space for both clinicians, wellness practitioners, and their patients or clients. It's a single location for patients to access any type of care, allopathic or wellness type care. Additionally, as a referral channel, Wellspaces offers Wellspaces retreats, which act as 4 to 7 day education, encouragement, and exploration type retreats, focusing on preventative health and preventative health practices. Who does Wellspaces serve? Wellspaces serves both private practice clinicians, that includes MDs, behavioral health providers, and other clinicians, as well as wellness professionals like yoga and Pilates instructors. Additionally, patients and clients can use the services provided by Wellspaces and the space provided by Wellspaces. Additionally, through wellness retreats, anyone really seeking to better their own health and improve their education in understanding how to improve their own health benefits from the Wellspaces retreats. And clinicians, additionally, also benefit from Wellspaces retreats because it's acting as a referral channel. So folks that only attend retreats may be interested in working with a provider at Wellspaces or vice versa. Additionally, other elements or stakeholders in the healthcare system benefit from Wellspaces in that patients are more educated, have higher health literacy, and have lower complications later in their time at these different organizations or healthcare organizations. Some of the competitors of Wellspaces include Lina and Cowork Medical. These are strictly medical co-working spaces. HUDCO and WeWork are more co-working spaces geared towards general audiences, although HUDCO is geared towards wellness practitioners as well. And then I wanted to include some of the strictly retreat businesses. Alderbrook Resort and Spa in Washington is a good example that are strictly in the retreat business and would be a partial competitor to the Wellspaces retreat. Where's the innovation and outcomes? What is being driven by Wellspaces? So Wellspaces provides a drop-in space to support private practices that would otherwise be really, really expensive or impossible for providers to do. Also, additional care can be provided to patients or clients because there is this collaboration and availability of different types of providers, including wellness practitioners. Wellspace also encourages this cross-collaboration between Western medicine, wellness, and alternative medicine. And one of the big components of this is patient advocacy and patient education, where they're really improving their quality of life, not only by focusing on treating a specific disease or acute issue, but really understanding and educating themselves, which in turn reduces costs later in life due to chronic disease or chronic conditions that are very, very costly. So the business model of Wellspaces. First of all, Wellspaces would be a certified B Corp, which would allow it to be opened as a sustainable business and in turn attract impact type investments. For the pricing to get into Wellspace, it's all based off of subscription pricing, both for patients and providers. There's also additional pricing for services as well as the retreats, not shown here. Some of the services may include telehealth and basically the entire scheduling app that's available with Wellspaces, as well as other clinical services that clinicians can use in the Wellspace building. The growth model for Wellspace is really based on the idea of cross-selling between the Wellspace and the retreat business. And additionally, because Wellspace becomes a community hub, it attracts new practitioners and other customers. Additionally, because the space itself will be valuable, we can open up the space for outside community events and other workshops. So a little bit about the expenses and revenue, profit and loss. So as you can see here, this is based on clinician and patient subscriptions, additional services, and retreats for the revenue. The year one that you can see is based off of about 50 unlimited provider licenses, 20 of the half-month subscriptions, and 100 drop-in times. And of course, that's based off of volume for that drop-in number. And then patients, on the patient side, this is assuming 100 unlimited subscriptions, 60 half, and 150 drop-in. The remainder for that first year revenue will come from retreats at about $50,000 and additional services that will be provided by Wellspaces. As you can see, the first year expenses are substantial. The first year really covers a lot of the capital equipment purchases, designing and building the Wellspace app that acts as both a scheduling app for patients and providers and also a telehealth app for the clinicians to use when they're not at Wellspaces. The year 2 and year 3 revenue continues to add additional subscriptions both for providers and patients. And then as you can see, the retreats acting as a channel, pushing more and more patients and providers into the space. You can see by year 2, there's the break-even point. In year 3, it is profitable by $775,000. Thank you, and that is my presentation.